Welcome to Tuesday's edition of COVID-19. There has been a slight rise in cases today, but it falls short of the 1,000 mark. Now, will the trend continue? Will there be a rebound? That is precisely what we are scheduled to discuss later on in the program. But first, here is our Consoa with the pandemic updates. So to start us off with the latest here in the country for this Tuesday.
Sure, Sunny. We do have a slight rise compared to Tuesday as the country has posted 537 infections as of 12 a.m. But what's noticeable is that the positivity rate has dropped to below 1%, and that's happened for the first time in around 2 months. Now, we do have a rise by 86 cases compared to yesterday, but as we can see, for over a week now, we are posting less than 1,000 cases every day now. Now, despite the overall decline, meanwhile, we have a decline in the average in the past 7-day span, as that has dropped to 668 now. And now, despite the overall decline, community spreads are continuing across the nation. All 17 provinces or major cities have been affected, but we do see more blue regions now than red regions, which means there are more places that have single-digit figures of new infections, but still triple digits in the capital Seoul in Gyeonggi-do province, and also 55 cases down in Gyeongsang-Namdo province. And this, although stringent social distancing measures are in place, speaking of which, the government said today that it will make an announcement regarding that on Saturday. Meanwhile, the total number of cases here in the country now stands at 69,651. We have a little less than 15,000 people in quarantine, but 390 of those are currently in severe or critical condition.
Right. So meanwhile, the global health body, I hear, had a rather discouraging forecast on herd immunity.
Right, Sunny. Although over 40 countries now have started their vaccination program and many others are poised to follow suit in the near future, the WHO's chief scientist said herd immunity will take some time.
Even as vaccines start protecting the most vulnerable, we're not going to achieve any levels of population immunity or herd immunity in 2021. And even if it happens in a couple of pockets in a few countries, it's not going to protect people across the world.
And with that, she also stressed the importance of existing prevention measures such as social distancing. And if we take a look at the worst hit nations, we do see it will take some time for herd immunity, especially in the U.S., for instance, which has already started its vaccination program. Still 23.1 million cases with over 225,000 new infections reported in just a day. And the UK has added some 46,000, raising the total to 3.1 million, that is. And also Spain is seeing resurgences, seeing actually doubling figures compared to last week, while South Africa at 1.2 million has added some 15,000 new cases, also dealing with the COVID-19 variant, just like Britain. And with that, the global tally now stands at 91.3 million with over 600,000 new cases. And those are the updates I have for now. I'll be back in a bit after the government briefing. Sunny?
All right, so I'll see you back at the desk. Right, staying on the international front, today we turn to the US, where healthcare workers continue to battle the world's worst outbreak. As I just mentioned, I have Professor Monica Gandhi at the University of California, San Francisco, live on the line. Professor Gandhi, welcome back.
Thank you very much.
Now, Professor, authorities there marked a grim milestone last Thursday with over 4,000 losses of lives in a single day, while the number of daily cases continues to hover at record highs. As a medical professional yourself, Professor Gandhi, how do you assess the situation in the U.S.?
We're in a very difficult period in the United States. Really high cases, hospitalizations, deaths. This is absolutely our worst surge to date. I think for a variety of reasons, including breakdown of compliance with public health measures and maybe excessive lockdowns and the holiday season and people getting together, and perhaps increase in transmissibility of the virus.
Meanwhile, Professor, New Jersey Congress member, I believe, recently tested positive for COVID-19 after sheltering in place with fellow lawmakers during the attack on the U.S. Capitol last week. Now, I hear her diagnosis has fueled concerns about a possible fresh cluster infection. Could you tell us more?
Yes, I mean that was a terrible event for our nation in multiple ways, but one way that it was terrible, the attack on the Capitol, was this idea that it could be a super spreader event because there were both maskless people, as you're showing, lots of clustering together, big crowds, scaling the Capitol walls, getting into the Capitol, and then what had to happen is lawmakers had to shelter in place in the actual Capitol building because they didn't know what explosives to be had. It was very frightening. And even when they were sheltering, some Republican lawmakers, unfortunately, declined to wear masks. So because of that, there certainly is one case reported likely from this event, and very concerning that this is going to be linked to become a super spreader event.
Right, Professor. President-elect Joe Biden, meanwhile, received his second dose of the Pfizer vaccine earlier on Monday. Now, initially, U.S. authorities had hoped to give at least 20 million people their first vaccine shots by the end of December, Professor. Now, that figure reportedly stands at 5.9 million at the moment. A rather sluggish progress, but is this progress looking to accelerate in the near future, Professor?
Yes, our progress towards vaccine distribution has been woefully slow. We are in such a surge that we have to turn this around. We have to get the vaccine out. We have to get more people to have immunity. The one question on the table is whether we abandon all these tiers that were set up by the CDC and just start mass vaccination programs in stadiums and football fields and in parks, or maybe just do it on age and then stop all this complicated system that we have for teachers and which essential workers get it first. So there's a lot on the table, but everyone is looking at this. I think Biden will accelerate it, but we have one more week until he becomes president.
Right. Meanwhile, Professor, at least nine U.S. states, that is, have reported the UK strain of the coronavirus. Having said that, what is the status of genomic sequencing over in the U.S.?
We do not sequence regularly these strains. And so when we say that there are 9 states and maybe 63 cases of the UK variant, it could be much more because we don't sequence that readily. And there was mention of a possibility of a US variant, but that was just complete speculation because our spread seems to be so fast. But there's never been an identified sequence that shows that. So we need to get our sequencing up if we really want to know these numbers.
Right. Professor, one final question. Dr. Anthony Fauci has claimed live theatre venues could reopen in the fall of 2021. Now, what are the prerequisites for such a scenario?
We really need to reach herd immunity in the United States for large crowds to be indoors, like what he predicted with the Broadway theaters. And we think that about 20% of people in the U.S. have been infected, which is pretty high because we really have not had the best response. And so if herd immunity is reached at 70%, we need 50% more people to be vaccinated. But probably people who've had it before are going to get vaccinated. So what will it take? Massive rollout of the vaccine in a much faster pace than we're doing.
I see. Hopefully that will happen, Professor. All right. As always, Professor, thank you very much for making the time to join us live with your thoughts.
Thank you.
Right, it's time now for the regular briefing on COVID-19 here in Korea for this Tuesday. And while we wait for that to start, perhaps we can take a quick look at the stringent restrictions on gatherings for social purposes until this coming Sunday. That would be the 17th of January. Social gatherings of 5 or more people, indoors and outdoors, are banned across the nation. This ban has been in place in the metropolitan region since December 23rd, before being extended, that is. Well, the briefing is about to start. We'll come back to you afterwards.
Let us now begin our regular briefing on the COVID-19 situation here in South Korea. As of January 12th, we have a total of 508 new local infections and 29 new imported cases. The total caseload now stands at 69,651. Currently, we have 14,917 people in quarantine, and there are 390 people with severe or critical conditions. And we had 25 additional fatalities yesterday, and the accumulated death toll now stands at 1,165. And I extend my deepest condolences to the deceased and the members of the bereaved families. And let us now look at our major updates of our domestic infections. First off, in the metropolitan area, in Seoul's Gwanakgu district, in relation to a religious facility, we identified the first index case on the 2nd of January. We have 20 additional cases, and now the total stands at 21. And in Seongdong-gu district, in relation to a residential area and also a nursing hospital, after we identified the first case of index case on the 9th, we have 12 additional cases being confirmed, and in total we have 13 cases to date. And in Gyeonggi-do Province, Ansan City, in relation to a welfare facility, we have identified 13 additional cases who were on isolation, and we have 26 total cases as of today. And in Gyeonggi-do Province, Yongin City, Suji-gu district, in relation to a religious facility, we identified 12 additional cases, and now the total caseload stands at 117. And in Chungcheong area, in relation to Chungcheong, Gwaesan, Eumseong, Jincheon-gun, and Ansong City as well, relation to their hospitals, there we have 13 additional cases being confirmed. In total, we have 406 cases being confirmed to date. And in Chungbuk Province, in relation to an hospital in Okcheon City, we also have 15 additional cases being confirmed, and in total, 22 have been confirmed to date. And in Honam Province, in relation to a Jeonbuk Namwon City Hospital, we have identified the first index case on the 7th of this month, and we have 9 additional cases being confirmed, and in total, we have 10 cases confirmed to date. And in Gwangju City, in relation to a nursing hospital in Gwangsan-gu district, we also have additional cases. A total of 121 have been confirmed to date. And in Gyeongnam Province, in relation to a prayer center in Jinju City, we have identified the first index case on the 9th of January, and we identified 31 additional cases, and a total of 38 cases have been confirmed to date. And in relation to a religious facility number 2 in Changwon City, we identified the first index case on the 4th of January, and we identified 8 additional cases, and in total, 9 cases have been confirmed to date. And as for other detailed information on other cluster infections, please make your inquiry to the spokesperson's office. First of all, looking at the past week, we would like to explain to you some outbreak trends. During the second week of 2021, we have seen a total of 5,000 cases during the week, and this is about a drop of 1,200 from the previous week. And of them, in relation to hospitals and nursing hospitals, we have 550 and about 520 people stemming from religious centers, and these major cluster infections are the largest cluster infections. And we also have identified 2,100 people who have been infected through the contact with previous cases, and we also have seen a drop of 1.7% of those in severe conditions. And also, we would like to provide you some updates on the BJT Mission Center. And on the late November and also late December, we also are asking people to get tested if you have visited this Mission Center, because we have seen many people being infected after visiting this Mission Center. And we have identified that we have received the visitor log for about 2,000 people who have been to this center, and we also tested about 910 people so far. And also, the total caseload now stands at 126 from this admission center. And also, we have identified local infections, further local infections, and at 9 provinces and cities, we have seen 27 cluster infections, and a total of 450 people have been infected so far. And in Daejeon, we have about 7 venues, and 6 in Chungbuk area, and also 2 in Incheon, and in Gangwon as well as Busan, we have 1 venue respectively. So nationwide, we are seeing accumulation of about 576 people infections stemming from this mission center. And we only have about 32.8% of the visitors getting tested. So we believe that these infections could also be on a rise further. So by each of the local authorities, we are conducting the local authorities to contact the visitors to get tested as soon as possible. However, most of these people are not receiving their phone calls, or even there have been false record of the visitor log as well. Moreover, among those who have been going to these centers, many of them have turned off their mobile phones, and therefore this is making our epidemiological investigation much more challenging. Right now, nationwide as well as globally, we are seeing a grave infection spread of the COVID-19. However, such a case could also hinder our investigation into the epidemiological investigation. So once again, we would like to urge anyone who has visited this mission center anytime between November and December, we ask you to get tested as soon as possible. And if you also have any symptoms after being in contact with these people who have visited the center, we ask you to get tested as well. And the quarantine authorities, we will be issuing an administrative order. We will be working together with the police officers as well, and we will implement so that these visitors can get tested as soon as possible. Lately, we are seeing a positive trend of a downward trend of the daily local infections. However, we are also concerned of a possible complacency on quarantine measures. Right now, we still have a possible rebound of the case and load here in Korea, and we also see that it is very essential that you participate in the quarantine measures. Last but not least, for the sake of everyone's health and safety, we ask you to get tested as soon as possible and send words of encouragement to others as well. Thank you very much.
백신과 관련된 질의에 대해서는 사전 양해 말씀드린 것처럼.
Right, that was Lee Sang-won with Tuesday's afternoon briefing. So what did he have to say?
Well, he mentioned that there is a visible downward trend in the coronavirus situation here in Korea, but figures can always rebound. So we still have to be vigilant, especially at facilities where we are continuously seeing cluster infections breaking out at religious facilities as well as medical facilities such as nursing homes. These two were one of the largest cluster infections that he mentioned. And speaking of religious facilities, the BJT Mission Center the BTJ Mission Center, that is, cases linked to that cluster infection. There are mass testings carried out, but there are people who are not going to the screening centers, which is why he called on any visitors between November and December to get tested if possible.
Right, and hopefully they will. All right, so thank you very much for that.
Thank you.
Right, Korea is poised to start its vaccination campaign next month, and should all go according to plan, the shipments will be made via air routes. Accordingly, in this next report, we cover the specifics of such shipments that demand stringent requirements to allow for a safe inoculation campaign. Do take a look.
In December, thousands of doses of Pfizer's COVID-19 vaccine were recalled in the U.S. states of California and Alabama after a transit anomaly caused a drop in the storage temperature. The incident underscored the importance of temperature control in safe and effective vaccinations.
코로나19 백신은 굉장히 다양한 플랫폼과 까다로운 유통, 보관 기준 등으로 콜드체인 유지가 매우 중요합니다.
Korea has so far purchased vaccines from 4 manufacturers. In particular, those from Pfizer and Moderna must be stored at a temperature of -70 and -20 degrees Celsius respectively. Vaccines are placed inside special containers filled with dry ice as soon as they come off the manufacturing line. These are transported by refrigeration trucks and also cargo aircraft for long-distance travel.
백신 수송은 세 가지 주체가 있습니다. 제약사가 있고요. 그다음에 그 백신을 수송을 담당하는 이제 조업사, 핸들링 에이전트가 있고요. 그다음에 이제 탑재된 항공기를 운영하는 이제 항공사가 있겠죠. 그 세 개의 주체들 간의 협업이 굉장히 긴밀하게 원활하게 유기적으로 이루어질 수 있는 체제 구축이 굉장히 중요합니다.
Temperature control is especially important at key transit points, which is why airports are now building cold storage warehouses for vaccine shipments that are waiting to take flight.
So in totally at Brussels airport, we have built 30,000 square meters of cooling facilities. So it's in different temperature ranges. It's for deep freezing, -20, temperature 2 to 8 degrees, and then the ambient temperature 15 to 25.
Korean air carriers have also built new cooling facilities and systems to manage them in order to better handle large vaccine shipments.
화물 터미널의 냉장, 냉동, 보온 창고의 개폐 현황 관리 및 정전에 대비한 비상 상황 계획을 수립하여 화물의 입출고 현황을 관리하고 있습니다.
Korean Air successfully transported COVID-19 vaccine raw materials to Amsterdam while maintaining a storage temperature of -60 degrees Celsius. Demand is also surging for dry ice, which is used to keep vaccines cool. Air regulations only allow a limited amount of dry ice to be stowed on board, owing to the potential hazards of carbon dioxide. However, the rules have been eased in order to accommodate large vaccine shipments.
Some airlines they've made exemptions, so larger amounts of dry ice can be carried on board of this aircraft. Of course, also a lot of the vaccines are carried on cargo aircraft only, where there are no passengers on board. Also, there the limitations are less strict. There is more possibilities.
In the case of Singapore, the city-state has newly built an entire cold chain infrastructure next to its airport to help better store the vaccines.
Vaccines are transported in temperature-controlled containers. In addition, we have temperature sensors fitted in the aircraft to track and monitor the conditions of the shipments. For added assurance, thermal blankets are provided to enhance the integrity of the cold chain. As more vaccines are produced and shipped around the world, more people will be vaccinated, and we will be a step closer to leaving this pandemic.
With COVID-19 vaccinations requiring a global effort and the coverage of vast distances, the role of air transport is crucial in distributing vaccines to every corner of the world at the right temperatures.
현재와 같은 그런 추세가 계속된다고 하면 0.88에 해당하는 그 수치에 따라서 일주 후에 한 600명에서 700명 이렇게 발생할 걸로 추정을 하고 있습니다.
다음 달이면 백신 접종을 시작할 수 있습니다. 우선순위에 따라 순서대로 전 국민이 무료로 접종받을 수 있도록 하겠습니다.
In recent days, Korea's daily tally has been noting a visible decline on the back of active testing and stringent social distancing. The task now appears to be maintaining this downward trend. For more, I have Dr. David Kwak from Suncheon University Hospital. Good to have you back, Dr. Kwak.
Thank you for having me.
And I also have Professor Lee Hoon Sang from Yonsei University. Pleasure to have you back, Professor Lee.
Thank you for having me today.
Professor Lee, some believe the third wave here in Korea saw its peak on Christmas Day when the daily infections stood at 1,240 cases. The daily tally since then has been hovering largely in the triple digits. Would you agree that this current trend or outbreak is on a downward trend?
It seems like we have passed the peak quite certainly, and it is lowest level since November 30th of last year. So I think we are in the downward trend, but at a high cost of the social lockdown for many of the people, especially the business owners. But certainly I think we are in a lowering trend at this point.
So you're quite optimistic about it as well?
Optimistic, we will have to see because the danger is once we lose the social distancing, we will have to see how things will change at then.
Of course. Dr. Kwak, some 2,000 cases were confirmed in about a month at temporary screening centres that had been set up to better track asymptomatic patients. Keeping these figures in mind, what are your thoughts about the role of these centres in containing the latest outbreak?
Well, they obviously played a great role in not only finding out who might have been infected, but also in the mitigation of the virus. But more importantly, I think as Dr. Lee said, it's more important that the whole population, the whole nation actually participated in the fight against the virus. People became actually more scared that they decided not to go out and socially mingle. Also the fact that a lot of the businesses had to suffer through in the hopes of the mitigation of the virus is also a very important factor that counted into this. But also having said that, having more test facilities to actually screen out more and more people gives us the tool to actually have all the people possible to track down upon so that we could have everyone temporarily isolated from the society so that we no longer have the virus going on inside or underneath the surface of the society. So I think, yes, the temporary screening centers have worked greatly in the helps of fighting against the virus, but I would like to also reemphasize once more again that we as a whole nation, the whole citizens actually did a great part in this.
Right, and we're continuing to do so. Professor Lee, come this Sunday, our current social distancing guidelines are set to expire. Now, some claim the measures may be extended, others claim that there might be an ease in restrictions. What are your prospects?
I think the government is currently considering partially easing the restrictions because certainly the current measure is quite beyond the level of the sustainability, especially for many of the business owners which are in great debt, and actually the economic difficulty is also something that we have to consider. But I think we have to be really careful at the point of the loosening of the social distancing. So I think government will take very careful step-by-step measure, but I think certainly there will be some loosening of the social distancing. And also, especially with the expectation of vaccine, maybe there can be some of the adjustment accordingly.
What are your personal thoughts regarding a possible ease in restrictions as a doctor yourself?
I think we are certainly at a lower level than 1,000 cases, and yesterday and today we are at the level of 400 to 500 cases. So if this trend continues, and especially if the government, if the country can keep the cases level below 500 or below 400, I think it can be justifiable to lose the social distancing. But again, I think the most careful, the time that we must be most careful is right at the time of the loosening of social distancing, because I mean, as we have experienced over last year, whenever we lose social distancing, and as the time passes, and as people loosen up their sense of carefulness, then we can always see this local transmission of the outbreak coming back again. So we still have to be very careful.
Right, it's been a vicious cycle of that. Dr. Kwak, I understand a local study on post-COVID-19 conditions has been disclosed following a survey of the survivors of the first wave here in Korea in Daegu. Around 12% of the survivors have spoken of muscle aches, memory losses, and so forth. My question to you is it possible for asymptomatic patients to also suffer from these after effects?
Well, there was also another study that was actually posted on a very renowned journal called Nature. And it actually resulted that people who were asymptomatic through their disease also showed somewhat of maintaining what we call sequelae in the medical terms, but long-term side effects. And those included not actually just the mild side effects. They sometimes included mental changes, cognitive changes, and it went as far as losing hair and sometimes muscle weakness and whatnot. So it seems like the next step that we would face after this virus is eradicated, hopefully, will be how we are going to manage the people suffering from the side effects from the disease. Sadly, though, it is the actual factual result that the Nature posted. And well, I have to, of course, emphasize that the percentage of the people that actually showed the side effects from the asymptomatic group were not the major. Obviously, there were very small groups, but they did have people that showed the long-term side effects. So it's something to be studied about probably early on, if possible, so we can better manage the people who are actually coming out of the disease.
Of course. Dr. Kwak, meanwhile, Chinese researchers found a tangible drop in COVID-19 antibodies in survivors in Wuhan. Does this finding mean these individuals are equally at risk of fresh COVID-19 infections?
Well, I wouldn't necessarily think so. It's more of a yes and no question. Theoretically, if we don't have antibodies against a certain virus, would we be more exposed to the attacks? Possibly, yes, theoretically speaking, but there are other parts of our immune system that also has long-term fights against the virus, such as a T-cell immune reaction and other B-cell types of immune reaction, not just the antibody types. So people who are lacking in antibodies, once they have had the infection, I think would still stay rather safe from the attack of the virus much longer on. But having said that, we cannot necessarily rule out the fact that because we have not yet seen those people who are infected already, that and then after losing the antibodies, have they gone through other possible exposure to the virus yet? So we never had that phase yet. Usually antibodies are known to have what's called half-life of about 3 months. That's meaning the levels of antibody drops half in about 3 months of time. So in 6 months of time, it would have reduced to about a quarter of the original level. So thinking about that, having people antibody levels for in the depiction of their fight against the virus, I don't think is a completely wholesome measure of how much the person has immunity against the virus. So we would have to also contain some studies regarding this and have maybe other tools to find out what people could show in regards to the immunity against the virus.
Right. Professor Lee, during his New Year's address yesterday morning, that would be Monday morning, President Moon Jae-in spoke of free vaccines for the Korean public. And health authorities are reportedly looking into include individuals between the ages of 50 and 64 into their priority list for the vaccine campaign. What are the implications of these intentions with regard to ensuring a successful vaccine campaign?
So certainly with the vaccine, we cannot vaccinate everybody at once. So we have to have some kind of prioritizations. And one of the highest priority will go into protecting those people who are in the front line of treating patients and people who are involved in the response. But also another aspect of the prioritization is protecting people who have a higher possibility for morbidity or mortality. So certainly it will start with the people who are above 60 or 70 years old, but also people in the age group of 50 to 64 years those people are likely, they have higher likelihood of having other underlying disease condition as well, such as diabetes and hypertension. So one of the important aspects is by vaccinating them, they can have a higher chance to be protected from having severe, to be infected from the COVID-19 and also face a severe consequence. So in terms of protecting the people, in terms of preventing a severe situation of the COVID-19 infection, I think it is quite good prioritizations. But later on, I think we will have to have also important prioritization in terms of expanding the coverage so that we can have achieve the herd immunity. But it will not be happening in a very rapid manner. So it will take probably until end of this year.
Right. Just out of curiosity, is it logical to have excluded children from the vaccine campaign, despite the fact that we are seeking to secure herd immunity?
Well, I think for children, for what we know so far, they do not suffer very serious symptoms. So, and also it seems like, I mean, during the earlier phase of the COVID-19 global pandemic, we were quite worried that, if the children will be kind of agent for transmission at the nursery and schools. But it seems like that did not happen very severely. I think one of the reasons might be the nature of their bodies in terms of their nature of the immunity. But also in school and nursery, we see that those children are keeping very good rule and they are following others very well, maybe even better than some of the others. So,
that's true.
So I think at this moment, maybe we are. I think there is not much of the justification to have them as highest priority at this moment.
Right. Dr. Kwak, vaccine manufacturers, meanwhile, are reportedly working to ensure their products can also are effective, that is, against coronavirus variants. Now, how long do you suppose will it take these manufacturers to come up with vaccines that target coronavirus variants?
Well, they would aim to make it obviously in much shorter time because they have already came up with a method to establish and develop a certain vaccination against this particular coronavirus. But except we have to remember that the process that it took the last year was rather very hastened. It did not went through all the ordinary steps that they usually would have taken if it was for a much milder disease. So it was, in some cases, in an extreme comparison, it could be said that it was taken 1/10 of a time, the usual time it usually takes for a vaccine development.
And how long does it take for a usual vaccine to be
Well,
developed?
I would say a few years at least. And I've seen something go up to from 6 years to 10 years. So having had done this in rather a few months of time is very, very hastily done. I'm not saying it's unsafe just because of that, but I'm rather saying that the new vaccines that has to be developed in case of a new strain that does not eradicate with the original vaccines. I would hope that it takes a certain more formal measures to be developed, as in clinical trials. We have done clinical trials number 1 and 2 in a very small amount of numbers, in 90. I've seen 90 to 100 something, and then they go on to 30,000 something for their third clinical trial. But in the ordinary fashion, in the vaccine development, each step takes at least a year or two. So let's remember that fact that for the second vaccine, if we have to develop one, should be more carefully done, not just in a hastily manner, just to fight off for the current issue.
I was just wondering, Dr. Kwak, what meaning does the advances we have witnessed during the COVID-19 vaccine manufacturing have for messenger RNA technology?
Well, I have a lot to say about this. Maybe I will cut short and talk about that in another submission. But so mRNA is a completely brand new type of tool for the medical sector to fight against any sorts of diseases, really, because it gives us this tool to actually put in a certain genetic code for the human body to based upon to start printing out certain proteins inside the body. And it's if the theory becomes true, that's such a game changer for all kinds of diseases, not just this particular coronavirus. Meaning, we can start printing out a certain protein to fight against autoimmune diseases. We can implement a certain genetic code inside certain human beings that lack, let's say, a certain metabolic enzymes, and have them live much longer because they will now be able to have those certain enzymes, proteins per se. So it's yes, two particular companies we were probably talking about, the new type mRNA type of messenger or vaccine. Or if it proves true that it is clearly working against this fight of the virus, would open up so many different doors for a lot of different disease entities as well.
So it looks to change the dynamics of vaccine production then?
Absolutely.
Professor Lee, health authorities claim the new social distancing guidelines that will come into effect after the 17th of January will take into account the unique aspects of the latest outbreak. Now, what aspects are we talking about, and what measures do you believe are necessary to better tackle these aspects?
So during the earlier phase of the COVID-19 pandemic in Korea, usually the outbreak was happening in terms of cluster. So there used to be a large group where the transmission was happening. But increasingly, lately, many of the transmission cases are happening within family and within small social gatherings. So I think in that case, just preventing all this kind of large gathering and all this business may not be optimal for strategy to reduce the transmission. So I think the government will take that aspect into the measure, and also maybe they will try to ease some of the social distancing, some of the unnecessary social distancing, so to make it more effective, but while giving some room for breathe for local businesses and all the business owners. So I think certainly the government will lose current measure of the social distancing, and there will be some of the readjustments. But I think one of the important aspect is what we have seen for last couple of days and since especially last week was with the very increasing of the cases in Korea, and also with the cold weather, people were actually staying home quite much more. So I think that actually worked quite well. But the danger is for some of the people, they might feel have a false sense of safety by just being around their family members or close people. They might be losing up with in terms of wearing the mask and keeping the protective measures. So what will be important is even though government loses the social distancing as a structural measure, I think the people still have to be very careful in keeping all the hygienic practice, washing the hands and wearing the mask. And even though they meet in the small gathering with family members, they still have to be very careful in their practice.
Right, and make sure not to take a false sense of security while being at home, of course.
Oh, sure, of course.
Dr. Kwak, please do remind us about the safety measures to be followed this week to ensure a continued decline in daily cases.
Well, okay, let me start by saying this. The nature of the virus has not changed at all. We're still fighting against the same type of virus, and we only were able to produce the decline in numbers by the whole nation participating, not socially gathering, and minimizing any kind of physical contact. And as I always say, 3 W's. Watch your distance, wear the mask, and wash your hands always. But at the same time, probably this week and early next week will be a very critical time to keep the trend of decline, because once we lose the scaredness and the carefulness that we are currently taking it can go back up exponentially in no time. So now is a very, very critical time. If we fight against the virus together just a little further, then we might hopefully start seeing a very low numbers and hopefully start seeing herd immunity created by the vaccination plan that we have.
Right. Professor Lee, keeping in mind what Dr. Kwok has just said, what are your words of advice to members of the public for this week?
I think it is really nice to see some loosening of social distancing, so people can move out and also have some level of resuming of their work and business. But again, as Dr. Kwok also said, it is no time for going back to the business as usual. If we just go back to our routine daily life, just like before COVID-19 pandemic began, if we or suddenly if people begin to meet together and have a social gathering and have a very free encounter with their friends and family members, we can always see this outbreak and this transmission outbreak coming back. So I think people should be still very careful. So even though they have a family meeting or social gathering, just try to maintain it for only the essential and most necessary meeting or gathering as possible.
Right. All right, Professor Lee, as always, thank you very much for your thoughts.
Thank you.
Dr. Kwok, thank you for being with us today.
Thank you.
Right, daily cases may be on a decline, but as our experts here in the studio, Dr. Kwok and Professor Lee have pointed out, variables still exist and they can turn the tide around. So do seek to abide by social distancing, do refrain from unnecessary outings, and do get yourself tested if you believe you may have been exposed to the virus. Thank you for watching.